Bonjour à toutes et à
Well, good morning, everyone, and thank you very much for coming, for accepting the invitation to be here. Now, you know that in the context of the development of 5G, the European Commission has taken initiative with industry to try and deploy our forces throughout Europe to try and come up with a roadmap, and different countries have to get that roadmap. With my colleague, Mr. Hristov, we wanted to organize this webinar with the STOA panel. And I'd really like to thank STOA because European citizens have really taken account of some of these issues, asking before 5G is rolled out that the European Commission query it and that there be a democratic debate to help understand what 5G is going to offer us. So that's the initiative. Why? Well, because the European Union has set rules saying, well, if we give money, 500 million euros, the European Commission is offering to roll out 5G with regard to public-private partnership. An impact study needs to be carried out in advance. And when we look at 5G, we realised that the Commission hadn't asked for environmental or health impact assessments. So we said, well, we want to respect the rules of the game, so we need an impact study on health and environment. That's why, at the request of my colleague and other MEPs, we were able to organise this. It's surprising, really, because in 2018, the committee looking at these risks, the environmental and health risks, said back then that we needed to know more about what exposure to these EMFs might produce, and that studies needed to be carried out on the health impacts. At the same time, you'll know, with my colleague Klaus Buchner, German MEP, we have carried out an independent study with the ICNIRP that set out recommendations which have been adopted by the European Commission, and we found that it has been influenced by the telecoms industry. In addition to that conflict of interest on the part of people who are in ICNIR, we found that the most recent recommendations that came out in 2020 were co-written with professional and industrial technical committees. So I think it's absolutely relevant now, and I'd like to thank in advance all the speakers. We've tried to set up a varied panel. That's why it's relevant that we examine this today, because the health study is going to be part of the roadmap and we need further clarification. I'm now going to give the floor to my colleague, Hristov, who is participating in running the webinar on the impacts of 5G on health and the environment. Ivo, the floor is yours.
Merci.
Thank you, Michèle. Ladies and gentlemen, I wanted to thank the scientific panel, STOA, which is helping us to organise this event. I'd also like to thank all the experts who, for a year and a half, have been looking at the effects of 5G networks and systems on the environment and human health. So we have a report which has been delayed as a result of the pandemic, but we are nevertheless going to hear from Mr. Ledoy and Ms. Thielens Mr. Thielens about the results of the debate and the study. We're going to try and see what the impacts of 5G deployment throughout the EU might be. The pandemic has shown increasingly that we are very dependent on the digital world. However, rolling out 5G should not be done in a hurry just because we've had COVID-19. And I think it's of concern that the Commission will publish a rollout plan for 5 and 6G without actually carrying out a risk assessment. And I think that all of this should happen only after we have all the knowledge at our disposal and all these instruments in our hands. So I think we need to be careful. Risk assessment studies are increasingly important. We're trying to anticipate future concerns by organising large national campaigns and European campaigns. This discussion will be our point for departure. It's not necessarily a definitive study, but I think this debate today between experts is going to allow us to have a more objective overview of the situation. There are polarised opinions. We have those who are unconditionally in favour in the economic and social sphere and sectors. There are also criticisms and concerns that have been expressed by citizens, and they need to be taken into account also. So we also have detractors, very fierce detractors of 5G, and they think there's some conspiracy behind it all. So we need to meet the concerns and take seriously the concerns of citizens, and we don't want to give rise to any more frightening scenarios than necessary. So there is a question mark hanging over 5G still, we feel, and this debate is going to allow us to find a balance, hopefully, between the two polarised extreme opinions. We will hopefully have the instruments at our disposal, the tools at our disposal to minimise the risks. And we have experts' opinions which help us to come to balanced decisions about rolling out 5G. I'm now going to give the floor to David G.
Thank you, co-chairs. Today, first of all, I have to say thank you very much for asking me to moderate this really important session. It's a privilege and an honour. So STOA has brought together 6 eminent EMF experts with somewhat different views to share their knowledge about the possible threats to the health and to the environment which 5G and associated 3 to 4G networks may or may not bring. This issue is one of the most complicated I have dealt with in nearly 50 years of work on hazardous agents. And we only have 2 hours. 1 hour for health effects focused on cancer with 4 speakers, 30 minutes for environmental effects focused on bees, trees and insects with 2 speakers, and about 20 minutes of question and answer on just these issues. And could those who have questions on these issues please send them to us via the chat function at the top right of your screen. We will not have time for discussion on questions on other issues raised by 345G, such as security and privacy, local planning procedures, etc. And to help us focus today, we have structured the presentations and the discussions around 3 key questions. Number 1, is the current 2020 ICNIRP, International Commission on Non-Ionizing Radiological Protection, risk assessment of the health and environmental effects of electromagnetic fields sufficiently robust and reliable for protective policymaking? 2. Are the ICNIRP recommended exposure limits for radio frequencies, which are based mainly on short-term tissue heating effects, sufficiently protective to avoid harm from lower level, longer term exposures that are below the ICNIRP exposure limits? And number 3, is there enough independent research into the health and environmental effects of 5G, which could help us to reassure the public and to help minimize future liabilities? So, as time is short, I would ask all panelists to help the translators and the participants by speaking slowly and clearly. I hope I've done that. To be courteous, of course, and to focus on the scientific issues under discussion today and their policy implications. Translations in English, French, Italian, German, and Bulgarian can be accessed via the button at the top left of your screens labeled Audio Channel Selection. Okay, so I think we're all ready to start. So I'd like now to introduce Professor Rodney Croft, who is chair of ICNIRP, and he is a professor of psychology, and he has worked for many years on brain function. Rodney, take it away.